Welcome back, everybody, for another Daily News Deep Dive.
Ready when you are?
All right, so today we have a pretty interesting mix of news.
Yeah, we've got healthcare, tech, global policy.
So why don't we just jump right into it?
Oh,
With
yeah,
healthcare,
good.
we're seeing kind of a mix of some troubling things and some
Yeah.
really, really exciting innovation.
Absolutely.
But first, let's get the tough stuff out of the way.
Okay.
Sadly, more hospitals are shutting down.
Yeah, it's rough.
Like United Medical Center in D.C.,
Right.
Kindred Hospitals in Illinois, and even the pediatric unit at Los Robles Regional Medical Center in California.
Yeah, these closures really represent a pretty significant loss for their communities.
For sure.
For instance, when United Medical Center closed down, 485 employees lost their jobs.
Wow.
And then when Kindred Hospitals consolidated in Illinois, there were 150 jobs cut.
It's easy to get caught up in the numbers,
Right.
but we have to remember that this is about people's lives,
Absolutely.
their livelihoods. And unfortunately, this trend is especially alarming for rural hospitals.
Yeah.
A recent report by the American Hospital Association really highlighted the severe financial strain that many of these hospitals face.
Yeah, and a big part of that strain is the rise of Medicare Advantage plans,
Right.
which often reimburse hospitals at lower rates than traditional Medicare.
That makes sense.
So it's really squeezing already tight budgets.
So it's like a double whammy for rural hospitals.
Yep,
Fewer patients and then less revenue per patient.
right.
So what does this mean for people living in these communities? I mean, how are they supposed to access care?
That's the big question, isn't it?
Yeah.
If hospitals have to close, then residents might have to travel further to get the care they need,
Right?
potentially delaying essential treatment.
That's scary.
It is.
But I think it's time to shift gears to a more optimistic development.
Okay.
And that's the growing role of AI in healthcare.
Oh, yeah. AI is really changing the healthcare landscape
Yeah.
in remarkable ways.
Totally.
For example, Hartford HealthCare is partnering with K-Health to launch this new virtual primary care service called HHC 24/7.
Oh, wow.
And it's all powered by AI.
So you could potentially have access to medical advice and care 24/7,
Exactly.
just from your phone or your computer.
Right at your fingertips.
That's incredible.
It's especially helpful for folks in underserved areas or people with limited mobility.
And it's not just virtual care.
No, not at all.
We're seeing AI being used to streamline drug development, improve diagnostic accuracy,
Right.
and even help with administrative tasks like coding at Walmart.
Uh-huh.
There are even companies like Lumeris who are developing AI-powered primary care services.
Yeah, like Tom.
Yeah, Tom, exactly.
They're really aiming for wide-scale adoption and impact.
Which would be amazing.
It would be.
But even though the potential of AI is enormous,
Yeah,
we have to be thoughtful about how we use it.
absolutely.
I mean, we need to make sure that these tools are properly validated,
Right.
that their effectiveness is measured,
Yeah.
and that their integration into our existing healthcare system is carefully considered.
We can't just throw it all in at once.
Right.
It's a careful dance.
We need to balance that enthusiasm with really careful consideration of the ethics
Uh-huh,
and all the practical implications.
for sure.
Now, speaking of different approaches to growth in healthcare,
Yeah,
some healthcare systems are looking at mergers and acquisitions.
right.
Like a really great example is Duke Health recently acquired a community health system hospital.
Oh, yeah, that was a big deal.
It created a lot of buzz.
A lot of it.
And it's part of a much bigger trend of consolidation
It is.
in healthcare.
Mm-hmm.
Just in the past month, we've seen 5 major hospital and health system deals,
Wow.
including Houston Healthcare joining Emory Healthcare
Mm-hmm.
and Inspira Health in New Jersey, implementing a new Epic EHR system.
It seems like everyone's trying to figure out
Yeah,
how to adapt and thrive in this ever-changing environment.
exactly.
While some are opting for acquisitions like Duke Health, others like Trinity Health are focusing more on organic growth strategies.
That's interesting.
It is.
It'll be interesting to see which approaches are more successful in the long run.
Yeah, time will tell.
Okay, so let's move from the outbreak room to the world of cutting-edge tech.
Okay, let's do it.
What's catching your eye in the technology world?
Well, Microsoft recently unveiled a brand new quantum chip
Oh, wow.
called Majorana 1.
Quantum computing.
Yeah,
That sounds like something straight out of a science fiction movie.
it kind of does, doesn't it?
Can you break it down for us? What makes it so revolutionary?
So, unlike regular computers that use bits, which represent either a 0 or a 1,
Mm-hmm.
quantum computers use these things called qubits.
Okay.
And these qubits can actually exist in multiple states at the same time,
Whoa.
giving them the potential to perform calculations at speeds we can't even imagine with current technology.
So are we talking about solving problems that would take normal computers years or even centuries in just a fraction of the time?
Potentially, yes.
What kind of impact could that have?
The applications are huge.
Yeah.
It could revolutionize medicine,
Uh,
material science, artificial intelligence.
really?
Yeah, leading to breakthroughs in drug discovery, developing new materials, and even advancements in machine learning algorithms.
Wow.
It really has the potential to reshape our world.
It's mind-boggling.
It is.
So for now, let's turn our attention to a more familiar name in tech,
Okay.
Apple.
All right.
They just announced that their AI suite, Apple Intelligence, will be available on their Vision Pro headset in April.
Yeah, that comes after the news that it would be in beta for other devices.
Right.
It seems like Apple's making a big push into AI,
They are.
integrating it across their products.
Yeah. And combining AI with a mixed reality headset
Right.
could open up a whole new world for how we interact with technology.
Totally.
Imagine AI helping you with everyday tasks or giving you real-time information overlaid on your surroundings.
It really blurs the lines between digital and physical.
So we've covered a lot of ground,
Yeah.
from hospital closures and AI in healthcare
Yeah.
to the amazing potential of quantum computing and Apple jumping into the AI game.
Uh-huh.
Each story shows us just a little glimpse into the complex forces that are shaping our world.
But it's important to remember that behind all these headlines are real people
Yeah.
whose lives are impacted by these changes.
Absolutely.
That's a really good point and something we need to keep in mind as we continue our deep dive into the news today.
For sure.
No, let's move on to the next topic.
Okay, sounds good.
Yeah, it's easy to get caught up in the excitement of it all,
Right.
but we always have to remember the human impact.
For sure, technology should serve humanity,
Exactly.
the other way around.
Right.
Speaking of technology's impact on society,
Yeah.
let's shift gears to global health policy.
Okay.
We have two pretty significant stories today.
Right.
A measles outbreak in Texas
Uh-huh.
and potential cuts to Medicaid by congressional Republicans.
Got it.
Let's start with the measles outbreak.
Okay.
It's nearing 100 cases in West Texas,
Wow.
and it's raising a lot of concerns about low vaccination rates and the possibility of undetected spread.
That's concerning.
It is, and it's reignited the debate about vaccine choice.
Right.
Some parents are hesitant to vaccinate their kids
Yeah.
due to misinformation or personal beliefs.
It's tough because the spread of misinformation, along with some of these new laws that are allowing for more exemptions from vaccination requirements,
Right.
it makes it harder to achieve and maintain herd immunity.
Exactly. This outbreak is a stark reminder of how important vaccination is
It is.
in preventing the spread of preventable diseases.
Absolutely.
Vaccines have been proven safe and effective,
They have.
and they play such a crucial role in protecting public health.
It's not just about individual choice either.
Right.
The decision to vaccinate affects the whole community.
Exactly.
It impacts community health and well-being.
Okay, so now let's turn our attention to Medicaid.
Okay.
Congressional Republicans are talking about making some pretty significant cuts to the program.
Yeah, to offset tax cuts and other initiatives.
Exactly. And this could have some major consequences for millions of low-income Americans.
Who rely on Medicaid for health care.
It provides a crucial safety net for vulnerable populations,
Uh-huh.
ensuring access to essential healthcare services.
Right.
Cuts to the program could have a devastating impact on people's health and well-being.
That's a scary thought.
It is.
There are definitely strong opinions on both sides.
Yeah.
Those who support the cuts often point to budgetary concerns
Yeah.
and the need to reduce government spending.
And those opposed emphasize how important the program is for those who depend on it.
Absolutely.
They argue that access to healthcare is a fundamental, right?
Right.
So this debate reflects a much bigger issue.
Yeah.
The tension between fiscal responsibility and social safety nets.
It's complicated.
It's a complex issue with no easy answers.
Uh-huh.
And the outcome will definitely have significant implications for healthcare in our country.
Absolutely. It's a reminder that policy decisions have real-world consequences for individuals and for communities.
It's important to really consider the potential impact.
Absolutely. We need to have informed and thoughtful discussions about these issues,
Right.
weigh the different perspectives, and
Yeah.
find solutions that are both fiscally responsible
Yeah.
and promote the well-being of all citizens.
It's a delicate balance.
It is.
So as we wrap up this part of our deep dive into the news today, what stands out to you as particularly significant?
For me, it's this recurring theme of navigating these tough choices in a world that's constantly changing.
Right.
Whether it's the financial pressures on hospitals,
Yeah.
the ethics of AI in healthcare, or finding that balance between fiscal goals and social programs,
Yeah.
we're always facing decisions with big implications.
You're right. It's a reminder that staying informed is crucial.
It is.
We need to understand the issues.
Yeah.
Engage in thoughtful discussions.
Mm-hmm.
and hold our leaders accountable for making choices that benefit everyone.
I couldn't agree more.
It's about being active participants in shaping our future,
Exactly.
not just passive observers.
Right.
So that brings us to a final thought for our listeners.
Okay.
What will you do with this knowledge?
Yeah.
How will you use this information to engage with the world around you?
Will you advocate for change? Will you challenge misinformation?
Will you make informed choices that contribute to a better future?
The power is in your hands.
Well said. Yeah, it can feel pretty overwhelming.
It can.
But like you said, knowledge is power.
Exactly.
The more we understand these complex issues,
Right.
the better equipped we are to deal with them and to make a difference.
Absolutely.
We've covered so much ground today,
We have.
from the very real challenges in our healthcare systems
Right.
to the incredible potential of quantum computing.
It's been quite a ride.
And we've seen how all these seemingly separate stories are actually connected.
Yeah,
They reflect these larger trends
they do.
and raise some really important questions about the future we're building.
For sure, for instance, the financial strain that hospitals are under
Yeah,
really highlights the need for innovative solutions like AI-powered care.
right.
But it also makes you think about equitable access and the potential downsides.
The unintended consequences.
Exactly.
And then the measles outbreak.
Right.
It really underscores how important public health measures are and the need to fight misinformation.
Especially in a time when it's so easy to spread.
Absolutely.
It's a lot to take in.
It is.
But that's what we do here on the Deep Dive.
That's right.
We go deep into the news.
We do.
We help you connect the dots.
We try
And we
to.
try to empower you with knowledge.
So as we wrap up this episode, I want to
Okay.
leave you with one final thought.
All right, I'm ready.
What will you do with what you've learned today?
That's a good question.
Will you share that information with others?
Yeah,
Will you maybe dig a little deeper into a topic that really caught your attention?
that's what I always do.
Or will you use your voice to advocate for change?
Yeah, that's important.
Remember, staying informed is just the beginning.
That's right.
The real power comes from what we do with that knowledge.
Absolutely.
Thanks for joining us on this deep dive into the news.
It's been a pleasure.
Until next time, stay curious and stay engaged.